Pharmacy India. So today's lecture is about the preparation of an examination that is MRB Pharmacist. This is lecture number 24 and we are going to discuss top 30 MCQs with their explanation on the topic drugs that are acting or drugs that acts on respiratory disorders. So before moving towards the questions, let's see some of the important points, such as if you have not visited Pharmacy India mobile app yet, you can visit Pharmacy India mobile app once by downloading it through Play Store. So you would ask me, ma'am, what are the things that are included in Pharmacy India mobile app? I would say that Pharmacy India mobile app consists of various test series, various courses, and some of these courses or test series might be beneficial for your preparation. So I would recommend you to kindly visit Pharmacy India mobile app, and you can visit it by downloading it from the Play Store. Pharmacy India has a website whose link is www.pharmacyindia.co.in. This website consists of latest updates, quiz, daily job updates, previous year paper, current affairs, subjective blocks, and college details. So these are the things that are included in Pharmacy India website. Moving further, the PPT or PDF of this lecture would be provided over Telegram. And every small little information, that is when is the registration form coming, what is the fees of the registration form, any topics, short notes, these are things are shared over WhatsApp and Telegram. So I would recommend you to kindly join our WhatsApp as well as Telegram group, and whose link would be provided in the description box. Moving further, exclusively for the preparation of MRB Tamil Nadu examination, we have prepared a book. One objective book, another is the theory book. Objective book, if we talk about objective book, it consists of 5,000 plus MCQs, 25 model paper, 4 Tamil language eligibility paper, 4 previous year paper, and 17 online tests as per the paper pattern. So these are the things which are included in this package. If we go to see what are the things that are included in theory book, the theory book consists of various subjects such as pharmaceutics, pharmaceutical chemistry, cognosy, ecology, biochemistry and clinical pathology, hospital and clinical pharmacy, pharmacy laws and ethics, etc. So these are the subjects that are covered in this theory book. So how can you order this book? You can order or purchase this book through various means, such as you can order through Flipkart. You can order through the link provided in the description box. You can also order this book from the app, from our app, Pharmacy India mobile app. So moving forward, one more book is there. This is the Mission Pharmacist book. This book consists of 30 previous year objective questions. 30 previous year question papers, which consists of the objective questions. This book also you can order through Flipkart through the link provided in the description box, or else you can go to visit our Pharmacy India mobile app, and from there you can order this book. Okay, this was the introduction part. Let's move towards the MCQs. MCQs today in today's lecture, MCQs would be based on the drug acting on respiratory system. So what are the drugs which are acting on respiratory system? In which condition, which drug would be used? Which drug would be used in combination? So these types of questions would be included in today's lecture. So let's move towards our first question. Which of the following mechanism of action is the characteristics of montelukast in the treatment of asthma? Asthma or asthma? Now, the question is, you have to find out the mechanism of action of montelukast. Montelukast, what does it do? If we go to see Montelukast is a leukotrienes antagonist. If we are going to be more specific, then it is a receptor antagonist. Receptor, which receptor? Leukotriene receptor antagonist. Okay, and it is and where does this functions? It functions in liver and bronchial tube. So option number B is correct. Antagonism of leukotriene receptor in lungs and bronchial tubes. Now, if we see that montelukast is it is a leukotriene receptor antagonist which acts by blocking this receptor. Okay, now what happens when it blocks this receptor? when it blocks this receptor, it would prevent leukotrienes to show its action. Okay, so what leukotriene do? Leukotriene shows inflammatory action. It secrete mucus. It causes bronchoconstriction. So these actions would get prevented. That would be beneficial for the treatment of the patient with asthma. Let's move towards question number 2. A patient with COPD is experiencing persistent airflow limitation. Okay. Which class of drug inhaled as a bronchodilator is often preferred in COPD and sometimes used in combination with beta-2 agonist for a synergic effect? So basically, a person is suffering from COPD, and we have to give a bronchial dilator that can be inhaled and can be given in combination with beta-2 agonist, and both the X drug plus beta-2 agonist would act as a synergic effect. The answer to question number 2 is option number B, that is anticholinergic agent. Anticholinergic agent. Now, see, what does cholinergic do? Cholinergic, if we go to see what are the cholinergic drug, cholinergic drug basically causes bronchial constriction. If we inhibit this cholinergic activity, then bronchial dilation would be the action, correct? So we in COPD, what we do, we give inhalational anticholinergic. The anticholinergic, what it do? Opposite to cholinergic action is the function of anticholinergic. Anticholinergic basically blocks muscarinic receptors in the airway. This would reduce bronchial constriction. Rather, it would cause bronchial dilation. And these are given with the combination with beta-2 agonist. Okay. Next, question number 3. Theophylline, a methylxanthine bronchodilator, exerts its effect through which primary mechanism related to bronchial dilation? So theophylline is a methylxanthine bronchodilator. Theophylline, basically how it works, it inhibits the phosphodiesterase enzyme. First option number B is correct. So how does it act? How does it functions? Theophylline, what it do? It inhibits phosphodiesterase enzyme. How? See, normally what does phosphodiesterase do? Phosphodiesterase breaks down CAMP, and this breakdown CAMP causes muscle contraction, smooth muscle contraction, ultimately leading to bronchial constriction. Now, when theophylline comes, it inhibits this phosphodiesterase enzyme. When this phosphodiesterase enzyme will be inhibited, then this breakdown would be prevented, bronchial dilation would be prevented, ultimately, bronchial constriction would be prevented, ultimately bronchial dilation will happen. I'll repeat once again what is the mechanism of action. See, in normal case, phosphodiesterase breaks down CAMP, and which would ultimately cause contraction in smooth muscle, ultimately leading to bronchial constriction. When theophylline comes to play the role, theophylline inhibits phosphodiesterase enzyme. It would inhibit phosphodiesterase enzyme. It would prevent the breakdown of CAMP. Ultimately, bronchial constriction would not occur. Bronchial dilation will happen. So this is the mechanism of action of theophylline. Let's move towards next question. Question number 4. Inhaled corticosteroids are considered first line therapy for long-term control of moderate to severe asthma due to its ability to. So corticosteroid has a is considered as a first line therapy both in moderate as well as severe asthma, because it has the ability to suppress the inflammatory processes. What does corticosteroid? It functions in various inflammatory pathways. So it suppresses the inflammatory processes in airways by reducing arachidonic acid synthesis and inhibiting COX-2 expression. What does it do? It works in various inflammatory pathway. By this, it reduces the production of inflammatory mediators like arachidonic acids. Also, it reduces the COX-2 expressions. Ultimately, it can be used, it is beneficial in treatment of asthma. Next, question number 5. Which of the following statement accurately describes the mechanism of action of chrominal sodium in the management of asthma? Here, the question is, it is asking about what is the mechanism of action of chrominal sodium. So, if you recall the classification of the drugs that are used in asthma, you would recall that chrominal is a mast cell stabilizer. It is a mast cell stabilizer. It stabilizes the mast cell. It would inhibit or prevent the release of histamine or leukotrienes. Ultimately, these would result in inhibiting the bronchial constriction. So option number B is correct. It would prevent the release of mediators such as histamine and leukotrienes from mast cell, thereby inhibiting the bronchial constriction. Okay. Now see, so it is classified as a mast cell stabilizer. If you would recall the asthma classification, mast cell stabilizer, this drug is only present. Only one drug is there, that is chrominal sodium. It would prevent the degradation of mast cell and and it would inhibit the release of inflammatory mediators such as histamine and leukotrienes. Question number 6. Omalizumab, an anti-IgE antibody, is indicated for which type of asthma? So this is a anti-IgE antibody, omalizumab. Omalizumab is a monoclonal antibody. It is remember, this is a monoclonal antibody. So these antibodies or these drugs are used for moderate to severe allergic asthma in a patient poorly controlled with conventional therapy. So let's move towards its explanation. Omalizumab is a monoclonal antibody which binds to IgE antibodies. It would bind to IgE antibodies and is used only in the condition when the normal therapy or standard therapy doesn't work. Where this normal therapy and standard therapy will not work, then omalizumab is given to treat the patient with asthma. Okay, question number 7. In patients with allergic rhinitis present with, if you see allergic rhinitis, what are the symptoms of allergic rhinitis? The patient with allergic rhinitis sneezes too much. Simultaneous sneezing is there, itching nose is there, watery nose, watery eyes. These are the symptoms of allergic rhinitis. The patient are always treated with antihistamines. But the side effect earlier was, if you would see that a side effect was that these drugs would cause the drowsiness. But now the patient treated with allergy rhinitis with antihistamine do not show a significant drowsiness. Why? Because first of all, which are the drugs? These are the second generation antihistamines like cetirizine, fexofenadine. These are the second generation antihistamine. You would ask me, ma'am, why these drugs do not show drowsiness? I would say that students, these drugs have less lipophilicity, will have less lipophilicity. Then what would happen? As these are less lipophilic, it would not cross the blood-brain barrier. It would not reach to the brain. And if it would not reach to the brain, then drowsiness effect would get reduced ultimately. So now the advanced version of the treatment of the patient with allergic rhinitis is that you can treat the patient with second generation antihistamines. Question number 8. Nasal decongestant such as phenylephrine exert their therapeutic effect by inhibiting the release of inflammatory mediators from mast cell, stimulating alpha alpha adrenergic receptor leading to vasoconstriction in nasal blood vessel, or option number C, blocking histamine receptor in nasal mucosa, or option number D, increasing the hydration of nasal secretion. Correct answer is option number B, stimulating alpha adrenergic receptor leading to vasoconstriction in the nasal blood vessel. How? See, nasal congestion such as nasal congestants such as the drugs like phenylephrine, how does it work? It activates alpha adrenergic receptors. It activates alpha adrenergic receptors on blood vessels. Alpha adrenergic receptor on blood vessels, which would ultimately cause vasoconstriction. Okay. Now, question number 9. Prolonged use of nasal congestant sprays containing oxymetazoline or xylometazoline can lead to which side effect? So, if nasal congestant sprays are used for prolonged time more than 3 days, then the side effect is option number A, rebound nasal congestion, rhinitis medicamentosa. Now, what happens if you give nasal decongestant for a longer duration of time? Then what happens? You get addicted towards it. Once these medications have been stopped, then the case gets worsened. It gets rebound again, and this time nasal congestion is bad as compared to earlier one. Okay, now let's move towards next question. Question number 10. Which of the following antitussive medication act peripherally by decreasing the sensitivity of stretch receptor in the lower airway and lungs? Codeine, benzonatate, dextromethorphan, or phenolidine? So the correct answer is option number B, that is benzonatate. Benzonatate is the correct answer. Benzonatate, it is a non-narcotic antitussive. It is a non-narcotic antitussive, and what it does, it works on a receptor that is present in the nasal pathway or respiratory pathway. It is a non-narcotic. First of all, it will not cause addiction. Next part is it acts by acting on the receptor that is present on the nasal passage or lungs or respiratory passage altogether, you can say. It reduces the reflex action as it is an antitussive drug. So it would reduce the cough reflex. It would reduce the cough reflex. Next question is question number 11, that is antitussive medication are generally contraindicated in which of the following condition due to the risk of sputum retention and respiratory depression? Correct answer is option number B, chronic pulmonary infection with significant sputum production. So let's move towards explanation of question number 11. In this, suppose a disease in which high sputum production is done. So high sputum is produced in disease such as chronic bronchitis and pneumonia. In this, if you suppress the cough using antitussive agent, what would happen? Then these cough or mucus would not get cleared up. It would get piled up in the respiratory system. So that's why antitussive agents would give the adverse effect. It would lead to increase or hinder the mucus clearance. Now, question number 12. Acetylcysteine is used as a mucolytic agent primarily because acetylcysteine are used as a mucolytic agent because so option number A is correct. Depolymerizes mucin glycoprotein oligomers by hydrolyzing disulfide bond. What happens? This N-acetylcysteine, what it will do? It will break the disulfide bond. These disulfide bonds, it would break in the mucus glycoprotein. See, in mucus, it has a glycoprotein. Mucus is made up of glycoprotein. This glycoprotein can be broken down by breaking its disulfide bond. By breaking its disulfide bond, its viscosity would get reduced. And if its viscosity would get reduced, it would be easy for the mucus to pass away from the respiratory system, leading to the clearance of the mucus. So, N-acetylcysteine, it breaks the disulfide bond in mucus glycoproteins. Question number 13. Which of the following is a potential serious side effect associated with the use of Xylitol, a 5-lipoxygenase inhibitor used in asthma management? So the correct answer is option number B, that is elevation of liver enzyme. So the side effect of Xylitol is that it increases the hepatic enzyme, or it causes the hepatotoxicity. Xylitol causes hepatotoxicity. So this is the side effect of Xylitol, and rest all are options. If you go to see, these are not the side effect of Xylitol. Xylitol has a side effect of hepatotoxicity. Therefore, the patient who are treated with this disease, or the patient who are treated with this drug are regularly monitored. They are seen that their liver function is proper or not, because this drug causes hepatotoxicity. Next question, question number 4. Ipratropium bromide, an anticholinergic bronchodilator, has a slow onset of action compared to beta 2 agonist, and is often preferred in the acute management of severe asthma, exacerbation, or the management of COPD for increased airflow and elevating symptoms, preventing exercise-induced bronchospasm, or treating asthma in children due to its lower incidence of systemic side effect. So the correct answer is option number B, the management of COPD for increasing airflow and elevating symptoms. How? Ipratropium. You all know ipratropium is an anticholinergic drug. Anticholinergic drug, that means it blocks the muscarinic receptor. It would block the muscarinic receptor. Ultimately, it would cause bronchial dilation. So that's why it is used in COPD. It has a slower onset of action. So you remember this point from this question, that ipratropium bromide has slower onset of action. Now let's move towards next question, question number 15. The primary mechanism of action by which corticosteroids induces inflammation in asthma involves affecting the synthesis of. So you know that corticosteroid, it works on various inflammatory pathway. It decreases the inflammatory mediated substances such as arachidonic acid. So the correct answer is option number B, arachidonic acid, by inhibiting phospholipase 2. So corticosteroid inhibits phospholipase A2, the enzyme that is liberating arachidonic acid from the membrane phospholipid. So this part I have explained you in the previous question. Let's move towards next question. Before that, exclusively for MRB Tamil Nadu, we have two books. One is objective book, another one is theory book. Objective books exclusively consist of 5,000 plus MCQs, 25 model paper, 4 Tamil language eligibility paper, 4 previous year paper, and 17 online tests as per examination pattern. Another book that I told you is the theory book. This book covers various subjects such as pharmaceutics, pharmaceutical chemistry, pharmacognosy, pharmacology, biochemistry and clinical pathology, hospital and clinical pharmacy, etc. So these are the subjects being covered in this theory book. There are various means to order this book, such as you can order this book through Flipkart. You can order this book through the link provided in the description box, or you can order this book visiting our website as well as our app. It's up to you from where you go and grab this book. Let's move towards next question. Question number 16. Which of the following beta-adrenergic agonist has a longer duration of action and is typically used for the maintenance treatment of asthma rather than for acute symptom relief? So the correct answer is option number B, that is formoterol. Formoterol is a long-acting beta-2 agonist. It is a long-acting beta-2 agonist. Okay. It has a longer duration of action. If you give it now, then for longer time, it would show its action. Now, question number 17. In patients with asthma who also have glaucoma should use nasal epratropium, should use nasal epratropium with caution due to the risk of. See, the question asks us that if a patient have asthma as well as it has glaucoma, both the diseases are there in a patient. So to this patient, if we are giving nasal epratropium, so one precaution should be taken. We should give it with a care because the person have a high risk of increased intraocular pressure. You all know that in glaucoma, what happens? In glaucoma, what happens? In the eye, aqueous humor production gets increased. Ultimately, intraocular pressure or intraocular tension gets increased. Okay, already intraocular pressure is increased. If you give ipratropium, anticholinergic drug, then what would happen? This secretion would rather get increased and increases the intraocular pressure to much more extent. This would be very much risky. So anticholinergics such as ipratropium can potentially increase the intraocular pressure, making them more concern in a patient with glaucoma. Next question, question number 18. Which of the following expectorant is thought to increase the hydration of luminal secretion and may involve increase airway water volume? So the correct answer is option number A, hypertonic saline, 7%. How? See, suppose this is a respiratory pathway. This is an airway. Okay, suppose this is an airway or this is a lumen in respiratory system. Here the mucus has been secreted and these are gathered here. Water is less. So to attract water, what we use? Hypertonic solution. If hypertonic solution is present here, it would attract water towards it. Once water will get attracted, mucus would get thick, viscosity would decrease and its clearance will increase. This is the purpose of giving expectorant. So correct answer is option number A, hypertonic solution. Hypertonic saline works osmotically, draws water into the airway. It will draw water into the airway. This would help to decrease the viscosity of mucus and thereby mucosal clearance would get increased. Mucosal clearance would get increased. Okay, question number 19. The respiratory stimulant effect of theophylline might be useful in COPD patient who tends to retain carbon dioxide. Yes, this is the correct answer. Option number A is correct. Question number 19, option number A is correct. See, theophylline has a mild respiratory stimulant effect that can help to improve ventilation in COPD patient who are prone to carbon dioxide retention. So this was the explanation itself. I don't think you have any doubt in this part. Next, move towards next question. Question number 20. Montelukast is typically administered by which route? Montelukast. Normally, you can see nowadays Montelukast is coming in a form of tablet. So it is administered orally as a tablet. Okay, Montelukast is used in asthma as well as in allergy rhinitis case as well. Nowadays, a combination of cetirizine plus Montelukast comes in a tablet form for treating the patient with allergy rhinitis. I have told you that this cetirizine is a second generation antihistamines. And what is the benefit of second generation antihistamine? That it would not cause drowsiness. Montelukast in combination with cetirizine is given to a patient orally in a form of tablet. The patient who are suffering from allergy rhinitis. Okay, let's move towards next question. Question number 21. Which of the following adverse effect is most commonly associated with inhaled corticosteroid use due to local disposition in oropharynx? So the correct answer is option number C, that is hoarseness and oral candidiasis. So you see, if inhaled corticosteroid is taken, then what happens? It gets accumulated or deposited in the oropharynx. When it gets deposited in the oropharynx, this would lead to the local side effects such as hoarseness in your voice and the local and the fungal infections such as oral candidiasis. Okay, now question number 22. Which of the following best describes the mechanism of action of mucokinetics drug? Among the following, you have to find out the mechanism of action of mucokinetic drugs. So the correct answer is option number D, that is the increased mucociliary clearance, often by acting on cilia. So mucokinetics, you can break this word mucosal kinetics. So these what happens? This would enhance the mucus to clear the. It would enhance the ciliary muscles to clear the mucus. It would enhance the ciliary action by enhancing or clearing the mucus. This would enhance the movement of mucus along the air path, stimulating the ciliary action. Okay. So question number 23. The question number 23 asks us to find out that the question says that in dry cough, a dry cough is a common adverse effect associated with which class of antihypertensive medication, which necessitates us to switch the drug from that class to a angiotensin receptor antagonist. So simply, if you see that in antihypertensive, there is a class, suppose X. This class of drug, what it does, it causes a side effect of dry cough. So this is the side effect. Because of this side effect, we have to switch from this classification, that is X, to angiotensin receptor agonist. So you have to find out which classification is this. What is the classification name? So the correct answer is option number D, that is angiotensin converting enzyme inhibitor. ACE inhibitor has a common adverse effect of dry cough. And to prevent this, what we can do, we have to switch from this converting enzyme, that is ACE converting enzyme, to angiotensin receptor antagonist. ACE inhibitor are well known to cause dry cough in some patients. And what it does, it is believed in some patients, this is believed to be due to accumulation of bradykinin and substance P. This is done, suppose, for example, if you can see in simpler language, what happens? This ACE receptor, this is the ACE receptor, receptor antagonist or inhibitor, ACE inhibitor. Simply, it is a ACE inhibitor. Now, this ACE inhibitor, it has a side effect of dry cough. You would ask me, how does this dry cough occurs? How does this side effect of dry cough occurs? Because what it does, it accumulates the bradykinin and substance P. This would ultimately lead to dry cough. So to prevent this dry cough, what we do, which switch from ACE inhibitor to angiotensin receptor blocker. Question number 24. Which of the following statement regarding the pharmacokinetics of theophylline is correct? So correct answer is option number A. It is extensively metabolized in the liver via cytochrome P450 enzyme. So theophylline, it primarily get metabolized. So most of the drugs metabolizes in liver, these we know. Theophylline similarly is a drug that metabolizes in liver by the enzyme, that is cytochrome 5 450. Okay. Next question. Question number 25. Aminophylline, a derivative of theophylline, is often used in the treatment of bronchial asthma and exerts its effect by. See, as theophylline, what it does, it blocks the phosphodiesterase enzyme. It would block the ultimately breakdown of CAMP would get reduced. Okay, this was the mechanism of action of theophylline. As it is the derivative of theophylline, it would work on the similar principle. Aminophylline will also block phosphodiesterase enzyme and would lead to increase in intracellular cyclic AMP. So option number A is correct. So let's move towards its explanation. Aminophylline is a theophylline which works by inhibiting phosphodiesterase. If this phosphodiesterase would get inhibited by theophylline or aminophylline, what would happen? Breakdown of CAMP would not occur. Ultimately, concentration of CAMP would get increased and bronchial dilation would take place. Question number 26. Which of the following is a contraindication for the use of anticholinergic bronchodilators like ipratropium bromide? The correct answer for question number 26 is option number D, that is narrow angle glaucoma. See, I have mentioned you in the previous question also that anticholinergic drug, what it will do, it would increase the secretion, and if it would increase the secretion, it would increase the intraocular pressure. In glaucoma, you know, glaucoma is due to the increase of intraocular pressure. If intraocular pressure increases, then optic nerve gets damaged. This is only the reason why glaucoma occurs, because intraocular pressure gets increased. And anticholinergic drug, if you give on top of it, then what will happen? Intraocular pressure would increase more. So this would be this would worsen the condition of the patient. That's why it is contraindicated. Question number 27. Zafirlukast, a leukotriene receptor antagonist, what it does, works by blocking the action of specific leukotrienes. You have to find out which specific leukotrienes does it blocks. Question number 27. The correct answer is option number D, that is leukotriene, that is LTC4, C4D4E4. It would block C4D4E4 and 1. So it would block C4D4 CDE. If you will remember like this, CDE, it will block CDE. Then you would remember this all your life. Now zafirlukast, it would selectively antagonize this leukotriene 1 receptor. And this leukotriene 1 receptor which mediates the effect of cystyl leukotriene C4, D4 and E4. Now question number 28. In the treatment of allergic rhinitis, intranasal corticosteroids are effective because they when we treat a patient who has allergic rhinitis, intranasal corticosteroids are effective because what would they would reduce inflammation in the nasal passage, alleviating symptoms like sneezing and runny nose. So intranasal corticosteroid reduces inflammatory response. How? Because you know, I have taught you in previous questions, like a corticosteroid, what it does, it works on various inflammatory pathway, and in working in various inflammatory pathway, what it will do, it will reduce the inflammatory secretions. Ultimately, it would help us to treat the patient with allergic rhinitis. Question number 29, last second question. Which of the following is a potential adverse effect associated with codeine and opioid antitussive? So a potential adverse effect you have to find out, it is constipation, because codeine, what it does, codeine is an opioid and it causes constipation, because what does codeine does, it inhibits the gastrointestinal motility. It would reduce the gastrointestinal motility, which would result in constipation, because the fecus is not moving forward. The food is not moving forward. There it is at their own place. Therefore, this would create a constipation case. Question number 30. Question number 30 is bromhexine is a mucolytic agent believed to have which of the following action in respiratory tract? So the correct answer is option number B. That is, it increases the proportion of serous bronchiolar secretion and reduces mucus viscosity. So this was the question. This was 30 questions with their explanation. And in this, you would find some part difficult, but the concept everywhere is same. The question comes from the mechanism of action of each of the drug, its classification. So please, students, and its adverse effect as well. So the students, I would recommend you to solve as many MCQs as possible and come to me if you have any doubt. Okay, so before ending this lecture, let's see some important points, such as if you have not visited Pharmacy India mobile app yet, you can download this app from Play Store and visit it once. You can, what you will get in this Pharmacy India mobile app, you would find many test series. Some of these test series are free of cost. You would find many courses and you can find out the best course that would help you to enhance or boost up your preparations. Next, we have Pharmacy India's own website, whose link is www.pharmacyindia.co.in. You get here latest update, quiz, daily job updates, previous year paper, current affairs, subjective blocks, and college details. The PDF of this lecture would be provided over Telegram, and you can join our Telegram as well as our WhatsApp group, whose link has been provided in the description box. You would ask me, what are the things that are provided in WhatsApp and Telegram group, and why is it beneficial for you to join? My answer towards it is, we provide every small information that is beneficial and that is important to reach at your end. We provide it over Telegram and WhatsApp, such as if any vacancy comes, number of vacancy comes, or if any registration forms comes, how to fill the registration form, or any notes that short notes in one page note, we think the need that it should be provided to you. These types of things are provided in WhatsApp and Telegram. So I would recommend you to kindly join our WhatsApp as well as Telegram group. We have, for your preparation, an exclusively MRB Tamil Nadu book, that is 2 books are there, objective book and a theory book. Objective book consists of 5,000 plus MCQs, 25 model paper, 4 Tamil language eligibility paper, 4 previous year papers, and 17 online tests as per paper pattern. Another book is there, that is a subjective book which consists of various subject theories, such as pharmaceutics, pharmaceutical chemistry, cognoscology, ecology, biochemistry and clinical pathology, hospital and clinical pharmacy, jurisprudence, etc. These subjects have been covered in this book and is exclusively for the preparation of MRB Tamil Nadu. How to order these books? You can order these books through Flipkart. You can order this book from the link provided in the description box, or you can order this book from our app. Next, we have another book, that is Mission Pharmacist book. This is also a fantastic book which consists of 30 previous year question paper, and it has 5 model question papers as well. This book also you can order through Flipkart. You can order through the link provided in the description box, or else what you can do, you can go to our app and you can order from there as well. So these are the methods through which you can order this book. Students, this was it for today's lecture. We have completed the 30 MCQs with their explanation. If you have any further query, first of all, you go through all 30 questions. You also revise this chapter, solve more and more MCQs as much possible. This would boost up your preparation. Okay, this was the guidance from my end. Thank you so much, students. All the best for your examination.